Hello friends, I am Dr. Manoj Bachhav, plastic and cosmetic surgeon, and today we are going to discuss regarding one of the very common problems in male, that is gynecomastia. So in today's discussion we are going to see what is gynecomastia, why does the gynecomastia occurs, and whom it is more common. Then we will see what is the treatment for gynecomastia. So let us start. What is gynecomastia? Gynecomastia means enlargement of male breasts, that is the male chest, which is usually flat, it increases in size and it looks more like females. It has various grades from grade 1 to grade 4 depending on the size of the breasts. It is classified. So why does the gynecomastia occurs? Basically, if we see the pathogenesis, we have to see that both male and female genders have the breast glands. Only in female the glands are developed, while in male it is not developed. That is why the male chest is flat. Now, due to hormonal imbalance, the male glands are stimulated and it increases in size and it looks more like female. Now, what is hormonal imbalance? Basically, the balance between the testosterone and the estrogen. If the testosterone is less and the estrogen increases, it causes the gynecomastia, stimulates basically the breast gland, and then it results into gynecomastia. Now, why does this imbalance occur? So basically, if we see the causes of gynecomastia, the most common cause is pubertal gynecomastia, which is very common. It happens usually in the adolescent age, that is between the age of 12 to 16 years of age. It is very common due to the, as I said, hormonal imbalance. The male glands are stimulated and it increases in size. Another common reason is medication, oral medication such as anabolic steroids or some antacids, or prolonged use of some anti-epileptics also causes the enlargement of breast gland. Another reason is some medical disorders such as liver cirrhosis, etc. So these are regarding the causes of gynecomastia and how does it occurs. Now we will go to the treatment of gynecomastia. If you have a gynecomastia, you should consult a nearby plastic surgeon, and then we have to rule out the causes of gynecomastia. If it is some medication or some medical disorder, we need to treat them first, and then we can go ahead with the treatment of gynecomastia. So once we have treated the underlying cause, the treatment of gynecomastia is pretty simple. Basically, what we do is liposuction surgery with or without gland excision. So basically, it is a daycare surgery. It can be done under local anesthesia with the infiltration in the local area. Local anesthetic is infiltrated and then we do the liposuction, or we can do it under complete general anesthesia. I prefer doing it under general anesthesia because it gives absolute comfort to my patient and it is 100% a painless procedure. In either case, it is a daycare surgery. You come in the morning, the procedure takes around 1 hour, 1.5 hours, and then evening you can go back home. How we do the gynecomastia surgery? Basically, we take a small stab incision on the side of the chest wall around 0.4 to 0.5 millimeter. We insert a specialized cannula and we inject a solution so that the fat is liquefied, and with the liposuction machine we suck out the fat part. And if we get the desired chest shape, that is flat chest shape, it is okay. Even if there is some residual gland remaining with the after the liposuction, we take it out with a small incision at the junction of nipple areola complex and skin. The incision is very hidden inside, and also we take a absorbable suture so that there is virtually almost no scar in the post-operative period. Now in the post-operative instructions, we ask the patient to wear a tight pressure garment, that is a jacket kind of thing that fits tight on your chest wall, that is required so that there is no potential space between the muscle and the skin nicely adheres and we get a nice chest shape. Another thing, we ask patient to avoid some heavy exercises. As we have operated above the muscle, we need to give rest to the muscle, so we don't ask patient to do heavy exercises or heavy weightlifting for at least 1 to 2 weeks. Routine activity he can start the very next day. He can go to the job in after 1 or 2 days if he feels comfortable. Now one more thing regarding the safety of the surgery. Many patient has the query that is it safe, as we are doing on the chest wall, it is near the heart and the lungs, so what will happen? So let me explain to you. This is a very safe surgery. Why? Because we are in the superficial plane, we are between the skin and the muscle. Basically, if we look at the anatomy in the picture, there is a skin, then we get the fat and the breast gland, then inside there is a muscle, that is pectoralis major muscle, then we get the rib cage, and then inside there is lungs and heart, and we are superficial to the muscle, so we are in the superficial plane, so it is pretty safe surgery. So this is regarding the safety of the surgery and the procedure. Now coming to the most common question that is asked by majority of the patient when they bring their children, whether should we do it or not do it. Surgery. Now let me first explain to you that this is purely a cosmetic surgery. We are doing it for the cosmetic reason to change this shape, to give the chest more of a manly shape, that is flat. But it is not always 100% a cosmetic thing, because many of the times, because of the enlarged chest shape, the person who is affected is not able to wear the loose t-shirts, is not able to do specific sports such as swimming. Also he can be teased out by the peer or his friends. So teasing is also one of the very common thing in this group of patients. It gives some psychological implications also, and patient, if it is in his mind 24 hours that my chest is not like flat or manly chest, so that can cause depression in him, and that can have the professional and that can hamper his day-to-day life and sometimes his professional career also. So yes, if that is hampering your day-to-day life and that is continuously in your mind, you should get rid of it. One more thing, you're not supposed, we don't need to do it in each and every case. If it is an pubertal gynecomastia, if you have between 12 to 16 years of age, we will wait till you are 18 years of age, and then only we are going to go ahead with the surgery. So as I told you, it is a cosmetic procedure, but it has some psychological or functional implications behind it also. So pretty simple, straightforward surgery. You can go ahead and get rid of gynecomastia in a day. So I hope we've solved your majority of the queries regarding gynecomastia. Thank you.